Congressman Anthony Weiner, Democrat of New York. Thank you very much for coming in, Congressman.
My pleasure.
Did you know that this loophole was in the Senate bill, and is it in the House bill?
Well, it's not in the House bill, but, look, here's been the fundamental problem we've always had. We had this problem with Medicare. Remember, when you were working in the House of Representatives, we tried to do catastrophic care under Medicare. Even Medicare, if you really break the limits, don't have coverage for you. It's a major problem, but let's remember what we're trying to do here. Part of the problem that we have is we're tying ourselves in knots trying to make sure the health insurance industry is protected throughout this process. They are unwilling to take any kind of a haircut. In exchange for getting 30 million new customers, you think at very least they would do is cover people when they got sick and very sick, and so that loophole shouldn't exist, and I'm hopeful by the time this thing gets ironed out, it won't be in there. You do need to make sure that when people really need it, health insurance is there. Otherwise, we're right back to where we started, which is them walking into hospital emergency rooms with stage 4 cancer.
Now, you're in favor of leaving the health insurance companies out of this sector of the economy, going with Medicare for all. In the Senate, they are not now talking about Medicare for more people, bringing that age bracket down to 55 and over. How does that sound to you?
Well, I like the idea. I like the idea for a couple of reasons. One, that group of people 55 to 64, they're the most vulnerable to the exploitive operations of the insurance industry. My dad retired before he was 65, and he had to go into the open market, $16,000 they wanted for an insurance policy. It also shows that we're getting back to trying to provide health insurance coverage where all the money actually goes to health care. Only 1% overhead in Medicare compared to 30% overhead in profits for the insurance companies. So here it is, they stumbled into it in the United States Senate, but they're trying to figure out how do we try to cover people at the most efficient way. Medicare was the way we do it for those 65 and older. Why not 64? Why not 55 and 56?
They are slowly finding their way back to the wisdom of Medicare. Now, they're also talking about in the Senate the possibility of allowing people to buy into what is in effect the federal employees health insurance program, the one that you're on, the one that senators are on. What about that?
Well, I also think it's another example of building on what works. 9 million federal employees and their families essentially have the exchange already. Insurance companies come in. Now, the thing to remember, though, is you as a taxpayer are paying our employer portion of our health care. Now, if we're going to bring in all these other Americans, we still have to figure out a way to contain costs. What we really should have is what Congress has with a public option as one of the options that we can choose. That would be the best alternative, and I think they may wind up getting there as well.
You've got the federal health plan there right now for the employees with all the options in that.
Well, the irony of all this, the same of my Republican colleagues who want no plan, no insurance, no exchange, they get this very nice benefit on your dime. They want them to get it, but they don't want any of the rest to get it.
13 shopping days till Christmas. There is no chance that the United States Senate is going to deliver you a bill before Christmas that can be conferenced with the House of Representatives. Is there? This is clearly going over into next year.
Well, you need more than the miracle on 34th Street for that to happen. I mean, look, my view is, though, I want them to take a little longer if they're going to get it right. It's been said that the Senate is the cooling saucer of our democracy. They're like a meat locker over there. They're doing one amendment every week or so. But if they're inching to the place that they're going to say, let's expand Medicare to let more people in, let's expand the benefits that members of Congress get so the uninsured can get those things, that's not a bad place to wind up. Notwithstanding some of the details, like the loophole you pointed out, I'm confident that's the direction we're going. It's a place that all of us can live with.
And what about this notion of ping-ponging? This is a legislative term I haven't heard before, where I've heard that Steny Hoyer has said to your caucus that they're thinking about taking what the Senate passes and simply passing it through the House of Representatives without putting it through conference, thereby delivering a bill for the President to sign because you would have passed identical bills. Is there any chance of that happening?
Well, it would get an enormous amount of opposition included from me. I mean, part of the problem is the financing mechanism that they came up with of taxing insurance plans that presently are given seems like a non-starter. But the argument for doing it is we've watched when we give the United States Senate any chance to deal with it, it takes them forever to get anything done, and we're held hostage by Olympia Snowe and Joe Lieberman. So there's a lot of members of the House that say, you know what, let's just take whatever they pass. I think that's not going to happen. I think it would be a bad idea if we did it.
Congressman Anthony Weiner, many thanks for your time tonight.
Thank you.